Our first question today is from Ben Milger, CTV. Please go ahead.
Thank you. Safe Schools Coalition is calling for air filters and CO2 monitors to keep track of air quality in classrooms. Is there any money available and are any plans in place to improve ventilation in schools?
I will turn that over to Minister Whiteside. I will say, though, that from the very beginning, ventilation has been one of the layers that we have been focusing on in schools across the province, and there has been a lot of work done on that, particularly in the summer of 2020 and again last summer when schools were on breaks. But Minister, you...
Thank you for the question. With respect to ventilation, we have made significant investments in HVAC systems across our education system. We've invested well in excess of $300,000 over the last $1 million over the last 2 school years, which districts have used to upgrade their systems, in some cases to purchase portable air filtration units where there is not mechanical HVAC available. We have been working with our education partners throughout this year to identify areas where we need to support districts to continue to do the work that they're doing to upgrade their systems, and that work will carry on, and we'll be looking at what the needs are in that respect.
And did you have a follow-up?
Yes, I do. This one is for Dr. Henry. Dr. Henry, people at low risk with symptoms have been advised to isolate, but told they don't necessarily need to get a test to confirm that they have COVID. So the number that came out today, the 2,944, likely isn't a true representation of the new cases in the province in the last 24 hours. You touted the different statistical tools at your disposal. Based on those tools, do you have an estimate of the true number of new daily cases that we are averaging, not just the confirmed positives from PCR tests?
Yeah, so the PCR testing is one, and the rate of testing is one of the surveillance tools that we've used all along. So it is a consistent, and that's one of the hallmarks of a surveillance tool, that it tells you the trends over time using that methodology. But yes, all along, we know that the daily numbers are not reflecting everybody who has COVID in our province. That has been the case from the very beginning, and at different periods of time, the actual true number can be varied by 4 or 5 times what we're seeing in terms of PCR testing. So I don't have an exact number for the last weekend, but we do know a small amount of the people who had rapid tests, who went to the testing centers, who reported. Plus, we know a little bit from early on in the pandemic where we had limited testing capacity. And on average, there's probably 3 to 4 times the number of people who truly have COVID than what is in our surveillance numbers on a daily basis. And that is something that we've seen throughout this pandemic. That it varies by community as well, by where we see transmission happening in communities. But right now, that's very likely to be the same differential across the province, because we are seeing, with the exception of the north, right now, we're seeing these very high percent positivity in the PCR testing across the province. So that gives us a sense of how this virus, this new strain, is spreading in many communities across the province.
Our next question is from Mike Hager at Globe and Mail. Please go ahead.
Hi there. Thanks a lot. Quebec just shortened its isolation period for doubly vaxxed healthcare workers to 7 days. BC's guidance was changed to 7 days. It appears recently. Can you explain why and when that was changed from 10 to 7 days for all doubly vaxxed people to self-isolate? And will BC follow the U.S. CDC's lowering of this period to 5 days?
Yeah, so we actually changed that based on data that we saw around how people were getting infected and how long they were infectious if they were vaccinated several months ago. So in the summer, we changed our public health guidance around what we were telling people who were cases, depending on their vaccination status. So we had changed to 7 days quite some time ago. We shared that information with our colleagues across the country, and I know we've been talking about the data that shows that people who are vaccinated are less likely to get infected, have milder illness, and shed less virus for a shorter period of time. And that's why we went with 7 days a few months ago. We know that for people who are not vaccinated, they still have a much longer period of time and shed more virus, so therefore are likely to be more infectious to others. We are looking very carefully at the data from the U.S. and the data that we are now accumulating of people infected with Omicron. And what one of the things that we have looked at here with our data is that incubation period, which shows that people are, and I talked a little bit about this last week, now that we see that a smaller amount of the virus can bind more strongly to the ACE2 receptors in our nasopharyngeal area, so the upper nose and throat, and that you can start replicating and shedding virus before you have symptoms yourself. What we are seeing here, which is very similar to what the US CDC based their data on, is that people tend to be infectious a day or two before they feel symptoms, but that the symptoms tend to be mild and drop off quickly. So we are looking at that very carefully, and whether we can shorten that period of infectivity. It's all about risk and mitigating the risk, because we know that some people will shed for longer. People who have a compromised immune systems, for example, can shed some virus for an even longer period of time. So being able to also get people back to work sooner if they have milder illness with other precautions in place. So making sure that we add wearing of masks, for example, keeping distances, making sure you're not in a crowded environment. And one of the things that we're very concerned about is healthcare workers becoming sick with Omicron in the next little while, and seeing if there's ways that we can have healthcare workers, for example, with very mild or asymptomatic cases working in some aspects of healthcare with appropriate precautions in place. So yes, we are looking at those in detail, and my team will be looking at that, and we'll be revising our advice as the data becomes available.
Mike, did you have a follow-up?
Yeah, what are you seeing in terms of staffing in first responders? We've talked to firefighting departments that want this period to be down to 5 days, and in the U.S., a third of the workforce is off in some departments with Omicron infections. So when and what will drive this decision if you do lower that limit to 5 days, and how is staffing across hospitals, fire departments, police?
We are starting to see the impact a little bit. It's very hard to tell, but certainly in healthcare, we're starting to see absenteeism from Omicron, mostly with mild illness. As you know, all healthcare workers are vaccinated. So somewhat different situation than what they were seeing in the U.S., where their vaccination rates are lower, so having more and more challenges with people getting quite sick. So that is something that we are looking at actively right now. So we will be making a decision in the next little while based on our data. But we expect that we are going to see increasing absenteeism given the rates of transmission we're seeing in the community. So it is a consideration. One of the other considerations that we made some changes some months ago around people who are vaccinated who have had close contact with somebody with Omicron do not need to quarantine or isolate for that potential incubation period, you can continue to go to work with using appropriate masking and self-monitoring to be sure that you're not passing it on in the workplace setting. And so that's another part of it that helps preserve our health, our workforces in those different essential settings. But this is certainly something I'll have more to say on very soon.
Our next question is from Richard Zussman, Global. Please go ahead.
This is for Dr. Henry and Minister Whiteside. Is there any consideration being given to fast-track teachers and school staff for booster shots, considering many of them will be sort of in their 30s, 40s, could be waiting up to 8 months between second and third dose? Is there any thought about prioritizing them? And what happens to the kids, the children of tens of thousands of school staff, when teachers and staff are back next week? What happens to these kids? How is support being done there?
Yeah, so we prioritize teachers and school staff, all school staff, as you know, for vaccination early on. So they do come up to their 6 months at a sooner period by age. So yes, we absolutely, many people who are, any school staff who are in their 60s will have, and have at 6 months, will get that invite if they haven't already. And by next week, they'll be down into the 50s. And it will be moving through very quickly as we ramp up over the next few weeks. So no, I do not expect any school staff or anybody who received their vaccine as we prioritize them to be waiting 8 months at all. They'll be moved up to the 6 months soon. And in terms of, you want to address the issue around supporting other?
Thanks, Richard. I do want to say that we understand that this will be disruptive for many families next week, which is why we wanted to ensure that we could get the information out about the delay of the return of students to school as soon as possible. We are going to continue to work with, certainly work with districts to ensure that for those in those essential situations where we have children with vulnerable needs who need access to schools, that we can organize for that next week. But I think we're in a situation where we need to act proactively now to ensure we can try to minimize the disruption and minimize absenteeism down the road. We want to have a successful return of students to school, and we need the time to invest in the assessment and planning, particularly to assess the impact on the workforce that we can anticipate will have happened over the course of the holidays.
Richard, did you have a follow-up?
Dr. Henry, Quebec just announced that they are going to be allowing sick healthcare workers to work in the healthcare system. Alberta has decided that they are going to allow those who are terminated due to not being vaccinated to return to work. Is BC considering either of these options to help protect the healthcare system? And also to this absenteeism that you spoke to, what are businesses supposed to do, including schools, if there are people who are sick or showing symptoms and can't get a test? Like, are these businesses, are you just expecting them to close if they can't find staff to remain open?
Yeah, so, thinking about business continuity is something that we all need to do through this. And there needs to be thinking through that. And that's one of the things that we're doing with schools, one of the things that we've been doing all along with healthcare. And yes, we are looking at fitness for work for people who have mild illness in the healthcare setting. And that is something that we have had preliminary plans for, but we're working with the occupational health and safety folk to make sure that we have those criteria identified for healthcare workers, and making sure we also have plans to be able to substitute other workers and move workers around as needed. obviously, if somebody is sick, whether it's with COVID or with any other illness, we don't want them in a workplace setting because it is a risk to others. But there are certain settings where we need to make sure that we have that balancing of continuity of care. Healthcare workers are one, police services, fire services. So we need to look at what are the measures that need to be in place to ensure that particularly people who have very mild illness or are asymptomatic are able to safely do work in those workplaces if needed. So those are all things that are in flux. It is a reality that for some businesses, if they have a lot of people off sick who aren't able to work, they'll need to find ways to either have additional staff or they may need to close. And this has been a reality through this pandemic, where if workers aren't vaccinated, for example, and you have workers transmitting to each other, that businesses have to close because they don't have enough people to care or to carry on their business. But these are things we want to prevent, and the best way to prevent them is by making sure that everybody in your setting is vaccinated and that we have those COVID safety plans, that thinking that we had that worked for us through the last part of this last 20 months or 24 months. So going back to thinking about what are the things that we have in place before we had vaccination that help us protect workers. So those barriers, the plexiglass that was in before, keeping space, making sure masking, making sure that workers aren't gathering together and having lunch together in a small break room. Those are all the things we need to go back to thinking as this strain is spreading through our communities right now.
Our next question is from Lisa Yuzda, City News. Please go ahead.
Just following up on what Richard asked about the teachers and school staff going back to work next week who have children, are you saying that they will have to find alternate means of taking care of their kids, which I've understood in the past was a concern because it's, putting kids together in group home settings that could possibly lead to more transmission? So is that what you're saying parents are going to have to do, or will parents who are also teachers and staff be allowed to send their kids to school as they would be essential, children of essential workers?
That's correct. So we're not closing schools. We're not going to online learning. What we're doing is having a phased approach to full back to school, and doing that in a way that allows us to make sure we're following what's happening in our communities. So my understanding, and yes, teachers will be able to, children of teachers, essential workers, healthcare workers, will be in school next week.
Lisa, did you have a follow-up?
You mentioned, Minister Whiteside, about the notification process and what's going to happen, that would be revamped. So I'm wondering if you could talk about what that is. And also if you can talk about, there were some other measures the BCTF wanted to see, which was N95s for teachers and enhanced masking or following up of masking for students. And I'm wondering if you can talk about, will there be additional masks of greater, protection available for staff and or students?
So I can talk a little bit about the notification because this is something we're working very closely on. As I said, in the past, what we have done is notified every case and when there's thought to have been transmission within a setting, so clusters and of course outbreaks. And with the rapid transmission that we're seeing, it's not possible to do each type of case notification as we did before. So we're working very closely with the schools about how they will notify parents about what's happening in the school community, of course, reflecting what's happening in the broader community. But we cannot expect to have that same individual case reporting and case follow-up anymore. Just because of what is happening about the rapid transmission, it is too far behind to make a difference. And so this is part of the message that all of us need to think about right now as we're going through this next new phase that's being driven by thankfully for most of us, milder virus that is transmitted more rapidly, we need to be able to notify those in our social contacts, in our close contacts, and let them know if we have COVID or if we're sick, so that people can take those appropriate precautions to stay away from larger gatherings, to stay away from people who may be most at risk during that period. So these are all the things that we have to do now to adapt to this new changing situation. And part of what we'll be doing next week is working very closely with the schools about how that will look, with public health working with each individual schools across the province. But it cannot be the same as what we have been doing all along, and we'll need to work together to make sure that we're appropriately notifying people about what the risk is. I think we can also be really reassured that, with other illnesses that we've seen, with what we've known about COVID all along, we know that our classroom settings in particular are safe. And they're not the places that are amplifying the transmission of this virus. And we don't expect that to be any different with Omicron. We still know that the people we get infected and the people we infect are our close contacts, our social connections, our family, those we're closest to. And you want to address the other?
Thanks, Lisa. Just with respect to, I don't have anything more really to add about the communication piece other than to say that I understand that parents and school communities will want to have an understanding of what's happening in schools, and that will very much be the work that's undertaken with at both a provincial and a local level between public health and education over the coming days. With respect to masking, we've certainly heard about from the school communities about the need to reinforce appropriate mask wearing to support children around appropriate mask wearing, and ensure that we have sufficient supplies available of the 3-ply masks that we've been providing throughout the pandemic, and that we will continue to provide. So that is also a work that will be undertaken next week.
Our next question is from Lisa Cordasco, Vancouver Sun. Please go ahead.
Thank you. Dr. Henry, you said that this is a different game that we're in now. But the rules about PPE by the Ministry of Health has not changed since March of 2020 when this pandemic began. So given the Omicron transmissibility in communities right now, will you change the Ministry of Health PPE policy to allow healthcare workers to decide themselves when to use an N95 mask without having to go through the point of care assessment and then getting approval from a supervisor?
So I think you're talking about two different things here, Lisa. One is what's happening in the community about the transmissibility of the virus, but the measures that we have in place, the infection prevention and control guidelines in our healthcare settings, in all healthcare settings, and that guidance is robust. It continues to be robust, and it continues to rely on a whole bunch of things. So engineering controls, and we've talked a lot about ventilation in hospitals with some of you and your colleagues. We've talked a lot about the measures that are in place. There's administrative measures, so there are higher risk settings and lower risk settings that we know even in healthcare. So if you're working at a vaccination clinic, for example, where there is not people who are ill for the most part, the level of PPE that you need as the last line of defense is different from working in a COVID ward or an ICU or the emergency department, where the acuity and the types of things that people are coming in with are different. So the point of care risk assessment is a basis for every healthcare worker, for every encounter that we have with a patient, that helps us understand what is that last line of defense that we need, knowing that everything else is in place as well. So that means masks on people coming in. And so the bottom line is, when we've reviewed that information, yes, you have to continue to do that. And N95 respirators are widely available and being used, as are elastomeric half-face respirators in ICUs, in COVID wards, in those higher risk settings now, and will continue to be. And there'll be continued, the guidance that we have allows for that, and allows for that that individualized assessment to happen on an ongoing basis.
Lisa, did you have a follow-up?
According to the BC Nurses Union, despite the policy that's in place, it is applied in a very spotty manner. Some nurses have easy access to N95s, others do not, yet they could be working under the very same conditions. The policy itself only refers to the spread being by droplets. The policy was written in 2020 when you had a shortage of N95. Why is there any resistance at all to allowing nurses to make their own decisions and having easy access to N95?
So that's not correct. The infection prevention and control guidelines have been updated. They do reflect the fact that we have an abundant supply now of respirators, and that they are accessible to healthcare workers in the situations that they need them across the province. And that's something we're reinforcing with our healthcare settings across the province.
Our next question is from Keith Baldry, CKNW. Please go ahead.
Oh, hi, thank you. The positivity rate seems to be exploding across the country, particularly Ontario and Quebec. But here in BC, we've gone from 9% rolling 7-day average on Friday to almost 15% today. Is there any reason to think that that's not going to continue to climb in the short term, which means we'll be hitting 4,000, 5,000, 6,000 cases a day? And is there any way to determine whether Omicron is definitively behind this real surge in positivity?
Yeah, it definitely is Omicron. We know by our whole genome sequencing that has really taken off. It's about, I actually haven't seen the data for today yet, but, we expect that the majority of these, whether it's up to 70 or 80% now, I'm not entirely sure, but it is in that realm. So this is being driven by Omicron across the board. And yes, our positivity rates are going up. They've took off first in the areas where they were the lowest, Vancouver Coastal and Fraser Health, and the one-day test positivity in Coastal today was around 20%. So we do expect that. However, the things that we are doing are also helping to dampen that. What we're trying to do, because we cannot stop the spread, what we can do is try and flatten it down and draw it out a little bit so that we are not seeing a rush on our hospitals. And this is something that I've been talking with my colleagues on this weekend across the country and elsewhere. There is an uptick, quite a strong increase in hospitalizations in Quebec, and what is driving that is one of the things we're trying to understand. We've taken some measures here to try and protect our healthcare system, including things like canceling surgeries, which is a very serious measure, both to try and protect the capacity, but also because we're concerned about healthcare worker absenteeism, given how we're seeing this spread in the community. So there's a lot that we don't yet know. I'm hopeful that the things that we're all doing collectively, like not having those large gatherings and trying to prevent ourselves from transmitting to others if we get sick, those will keep us from having continually increasing rates. But it's in our hands now. I don't know if you want to add to that. Yeah.
Heath, did you have a follow-up?
Yes, in terms of the booster doses, Minister Dix mentioned almost 250,000 people have received invitations to book, but have yet to do so. I know the uptake for third doses wasn't expected to be as high perhaps as second doses, but does this strike either of you as unusually a high number of people have been offered to take to book a third dose, yet to take the opportunity to do that? And it doesn't sort of make the whole argument of whether it's a 6-month or 3-month interval almost a moot argument if so many people just aren't taking that third dose?
Yeah, we really, our strategy has been, since we made the decision around booster doses, is to protect those most at risk first. And we do have good, strong vaccine effectiveness. And I just saw some preliminary data that will be coming out very soon from BC CDC on to up to 8 months, where protection from hospitalization is still very strong in the 90% range. So that's good. The protection, you saw some data from the Science Table Ontario against infection has gone down quite dramatically. We haven't seen that yet here. We just haven't collected enough of that information yet to be able to look at that. But, it's, I can only just say it again. If you're due for a booster dose, get it now. There are a number of people that are asking for it. There's a number of people who, like with all of this, have been complacent or have other reasons why they haven't yet got their booster dose. So more and more people will be invited to book their boosters, and more pharmacies and larger clinics are coming online in the next couple of weeks. So we can move that up for more and more people.
I think the purpose of saying this, Keith, is simply to say that there are spots available. I think sometimes people may think there are not. And it is a little bit different. In different health authorities. For example, our health authority clinics based in Vancouver Island are fully booked this week, and in other health authorities, there's a lot more room. So it's not necessarily consistent around the province. But I think what it tells us is that the number of bookings is going up significantly. The number of people who are getting their 6 months has also increased significantly in the hundreds of thousands in the last week, for example. So we're in this period where people will need to catch up to the situation, understand that when you receive your notification to book, the sooner you book, the sooner you get your booster dose, which is important for you, and that you should go ahead and do it. So I think it's much too early to sort of try and find trends in it. It's really to tell people that when they're invited to book, they should book. And I want to especially emphasize the importance for healthcare workers when they're invited to book. That's a critical thing that they need to do.
We have time for one more question. Our last question today is from Belle Puri, CBC. Please go ahead.
Hi there. Of course, we need our answers in English and French, please. So now we're in a situation that, the danger of Omicron is so severe that the start of the school term needs to be delayed for most students. So can you explain, please, why the province didn't make it mandatory for teachers and school staff to be vaccinated, as government did virtually with every other public sector job in the province? And Dr. Henry, you talk about, we'll know more about the variant in the next week, and the phase-in is to see what's happening in the community. So there's a chance this phase-in, this delay to the start of the term, could be extended?
The answer to that is no. This is just giving us a bit more time to deal with the situation that we're in and to plan for things like absenteeism, because we're starting to see that, as we mentioned, in healthcare and across the board. So it really is about continuity planning and making sure we have the best things in place. This is not a delay in start to what am I trying to say? This is not going to online learning, because we know that was not something that supported children across this province. It's much more important that we get them back into the classroom, and we are committed to doing that. That is our number one priority, and we're doing it in a way that recognizes the uncertainty that we're dealing with right now. And we're working together to do that with the education sector, with all of the superintendents and the schools and the teachers and the parent groups, so that we can do it in the best possible way and minimize disruption to children and to their lives. So that's the focus of this, and we are committed to doing it. And the extra few days is to make sure that we're doing it in a way that supports the school communities across the province. As you know, I have always said that I think that every person who works in our school system should be immunized, and that's important, but it is up to the employer, which are the school districts, to bring in those policies. Having said that, we do know that across the board we have very high rates of immunization in the school staff, so that's important. That supports schools being able to operate safely, and we know we have increasing rates in children, and now more recently in children 5 to 11.
Premièrement, vous avez raison que on a pris une décision que la vaccination doit être obligatoire dans le système de santé pour des raisons importantes. On sait que d'autres provinces ont pris d'autres décisions, mais nous, en Colombie-Britannique, à dire qu'il faut que des gens dans le système de santé soient vaccinés à 100% et on reste sur cette position. À cet égard, en ce qui concerne les écoles, la vaste majorité des enseignants, des gens qui travaillent dans le système scolaire, sont vaccinés. C'est une décision des conseils scolaires de chaque région, mais cela étant, ce qui est essentiel, c'est de créer les conditions que des gens soient sains et saufs et aussi protégés contre le COVID-19 que possible dans les écoles. C'est ce que nous sommes en train de faire et c'est à cause de cela qu'on a pris, on va prendre la semaine prochaine pour préparer cette partie de l'année scolaire 2021-2022.
Belle, did you have a follow-up?
Yes, please, and again in English and French. So this is about the booster shots and a lot of people being frustrated that people in their age category and younger are being given boosters in other provinces. Some are heading to the United States. Now, I know you referenced this a little bit earlier, but can you explain again why BC can't roll out this program sooner for more people? And, these 240,000 unbooked booster appointments, could those unused appointments go to people who want those boosters right now?
Yeah, so we have focused, as you know, on making sure that those most at risk have the ability to get their booster soonest first. And that has proven to be very successful for us in that we have very high rates of getting booster doses into people 70 and over. And that was the focus. It was really making sure that those most at risk got it first and had access. And when we talk about the 200,000 people that have been invited, yes, the appointments have been titrated for the invites. That means they are available, and we have been able to move other people up, and we are doing that more rapidly. But it also, again, reflects that balancing that we have to do in that we know that that extended interval between dose 2 and dose 3, even longer than 6 months, probably gives longer lasting, stronger protection as well. So finding that balance, and I would just say that if you're coming up to your 6 months, you will be getting your booster within the next few weeks. These are ramping up quickly, and we particularly have pharmacies that are ramping up to be able to provide it for people conveniently in their communities.
And just to say, I think it's important to recognize that 151,627 clinically extremely vulnerable people in the most vulnerable categories, people who have challenges to their immune system, have been put towards the front of the line. They were for first and second doses. They are for third doses, for good reason. And this will benefit them, their families, the community, the province, and the healthcare system. It's an important thing to do. So often, if someone's getting it before you, it's for that reason. Or it's because they've received 2 doses of AstraZeneca and it's been determined by our clinical experts that they should get it as soon as possible at 6 months. Or otherwise, it's age, clinically vulnerable. We have given priority to Indigenous communities, as we should, given the vulnerability often of those communities, especially isolated communities around the province, should a variant of concern visit them. And so more than 50% of eligible Indigenous people have been vaccinated. That's an excellent recognition of the work of the First Nations Health Authority and our health authorities across BC working together. And I want to thank them for their exceptional, extraordinary efforts, as I do the First Nations Leadership Council and First Nations and Indigenous leaders across BC.